I would like to talk about effects of anatomical double-bundle ACL reconstruction on the contact characteristics of the patellofemoral joint. Background. Single-bundle ACL reconstruction is most commonly performed for ACL injuries. However, anterior knee symptoms are reported by about 20% of patients after the ACL reconstruction. 47% of patients had mild to moderate radiographic degenerative changes in the PF joint after the conventional single-bundle ACL reconstruction. In recent studies, anatomical double-bundle ACL reconstruction has been demonstrated to better restore normal knee biomechanics, kinematics, and function of tibial femoral joint. So the aim of the study is to investigate the effect of ACL deficiency, conventional single-bundle and anatomical double-bundle ACL reconstruction on the contact characteristics of the PF joint in the knee. We human cadavers in this study. We tested in 4 experimental status for each specimen. First, the knee was tested with ACL intact. After ACL transection, both reconstructions were performed and were tested again after reconstruction. Finally, ACL deficient knees were tested. Both reconstructions were performed in an open fashion in the same knee using the hamstring autograft. 2 tibial tunnels were drilled in the center of AM and PL insertions, and 3 femoral tunnels were drilled in the center of AM and PL insertions, and high anteromedial, high AM, which was made at 1 o'clock position for the left knee. Conventional single-bundle ACL reconstruction was performed using the tibial PL to femoral high AM, and double-bundle reconstruction was performed using each original tunnels. We performed femoral fixation by end botan and tibial fixation by post screw with 20 degrees knee flexion, applying maximal manual forces. We measured at 30, 60, 90 degrees of knee flexion under quadriceps muscle loads of 100 Newton. Pressure measurements were recorded using Fuji press scale pressure-sensitive films to determine the contact characteristics of the PF joint. We calculated the total PF contact area, average, and peak contact pressure. We also calculated the medial and lateral facets contact area and the contact pressures. After all experiments were finished, we took lateral plane X-ray. The tibial and femoral tunnel position were determined using methods described by Ames and Bernardo. Statistical analysis were performed using Friedman and Wilcoxon test. Results. In the total contact area, ACL deficient and single-bundle reconstructed knee significantly decreased by 60% and 73% at 30 degrees of knee flexion when compared with the intact knee. In the medial contact area, ACL deficient knees significantly decreased by 52% and 60% at 30 and 60 degrees of knee flexion. In the lateral contact area, there were no significant differences. The average contact pressure as shown in this slide in the combined medial and lateral facets There were no significant differences for all other status and intact knee. The peak contact pressure as shown in these slides. In the combined and medial facet, there were no significant differences between all cases and the intact knee. However, in the lateral facet peak pressure, deficient knee and single bundle reconstructed knees significantly increased by 165% and 180% at 90 degrees of knee flexion. Double bundle reconstruction restores the contact pressure and areas to values similar to intact knee. Radiological measurements, the position of the AM and PL tunnels as shown in this slide. These positions are similar to previous anatomical studies. Discussion. We found that ACL deficiency resulted in significantly decreased in the total PF contact area at 30 degrees and medial contact area at 30 and 60 degrees. This is an agreement with a study by ZA et al. In an in vivo kinematic study, resultant PF contact forces were decreased by 30% in an ACL deficient cat knee. Our study showed that contact area and pressure of the patellofemoral joint were not restored to normal values after the single bundle ACL reconstruction. Although an opposite tendency was observed by ZA et al. However, our findings are supported by Van de Velde et al. They reported that abnormal patellar rotation, tilt, and lateral shift persisted after the single bundle reconstruction. So, these persistent abnormalities of the PF contact characteristics and motion help to explain the PF OA and other PF programs after the single bundle ACL reconstruction. We also showed that the double bundle reconstruction closely restored normal values with contact area at lower flexion angles and contact pressure at higher flexion angle. The double bundle ACL reconstruction might restore normal tibial-femoral rotational kinematics, resulting in normal PF contact area and pressure. This is because the patellofemoral joint is closely linked to the tibial-femoral joint. There are some limitations, several limitations of this study. First, second, third, as shown in this slide. Fourth, this model used just a single muscle group and obviously did not reproduce physiologic muscle contraction. Finally, our experiments simulated the time zero after surgery and could not address the effect of the biological changes during the healing process. In conclusion, the anatomical double bundle ACL reconstruction closely restored normal PF contact area and pressure compared to those after conventional single bundle ACL reconstruction. Thank you for your attention.
Thank you very much, and I apologize for omitting Freddie Fu. Any questions?
I have one question. I have one question that I just wonder that the group that do the single bundle reconstruction right now, they move the tunnel placement to the center of the anatomical footprint, not go high like that. Why not you compare anatomical single tunnel reconstruction with a double tunnel?
Thank you very much. I think it's very important question because I think most important things for single bundle reconstruction is tunnel position. In this study, we have to check the conventional single bundle ACL reconstruction, so we didn't make anatomical single bundle reconstruction model. However, if we made a anatomical single bundle reconstruction model, it would be a more, a good results compared with conventional single bundle reconstruction.